Hey everyone, welcome back to Discussions with Dr. G. Today we are talking about vitamins and minerals. I'm Dr. G, your sarcastic nursing professor who's seen more supplement mishaps than I care to admit. Today we're talking about supplement safety, because believe it or not, vitamins and minerals can absolutely ruin your day if you're not careful. Let's kick things off with iron, the OG of anemia fixes. We've got ferrous sulfate for oral use and IV iron dextran for those times when the gut just isn't cooperating. Both are supposed to help your patient stop looking like they're auditioning for a vampire movie. But oh boy, the side effects. GI distress is the big one. Nausea, constipation, and my personal favorite, black tarry stools. Nothing like a panicked patient convinced they're bleeding out when really it's just the iron doing its thing. And if you're giving liquid iron, please, for the love of their teeth, use a straw. Unless your patient wants to rock that medieval gray smile. Now, IV iron dextran is a whole other beast. You have to do a test dose first because in rare cases, it can cause anaphylaxis. I mean, nothing says fun like a code blue over a stinking vitamin, right? Here's the thing about absorption. Iron loves an empty stomach, but your patient's stomach doesn't love iron. Vitamin C will help with absorption, but it's also going to ramp up the GI upset. Don't even think about giving it with dairy or antacids unless you just want it to pass right through your patient and have no effect at all. I always tell my patients to take it with water, not your morning latte. All right. Be aware that you may give oral iron to your patient who then starts vomiting black after administration. Don't panic thinking it's a GI bleed. Call the doc, the whole 9 yards. It's just the iron. So yeah, always double check what you're giving, how you're giving it, and maybe keep a mop handy. Moving on. Let's talk about B12 and folic acid. Cyanocobalamin, that's your B12. Yeah, you heard me. Cyanocobalamin, it's a mouthful, but it's also a lifesaver for pernicious anemia. It helps your patient make normal red blood cells and keeps their brain from turning to mush. But plot twist, as you make new RBCs, your potassium levels can drop, so you have to watch for hypokalemia. Yes, allergic reactions are rare, but they do happen because nothing in this life is ever simple. Here's where it gets a little tricky though. B12 absorption can tank if your patient's on metformin, PPIs, or H2 blockers. PPIs and H2 blockers are GI meds that decrease the amount of acidity in our stomachs. So if you've got a diabetic patient who's on metformin, who suddenly can't remember their own birthday, check their B12 level. Folic acid. This is another biggie, especially for pregnant patients. Folic acid prevents neural tube defects in the fetus and neonate. It's really big deal, okay? Here's the catch. If you give folic acid without fixing the B12 deficiency, you can mask the anemia and leave neurological damage, okay? It's like fixing a flat tire by painting over it. It doesn't work. Methotrexate and sulfonamides can also mess with folic acid's effectiveness, so again, remind your patients of drug interactions. Bottom line, monitor your labs, know your patient's meds, and don't just throw vitamins at a problem without thinking it through. All right, so let's get into the real danger zone, potassium and magnesium. Potassium chloride is great for hypokalemia, right? It's going to raise their potassium levels. But if you mess up the dose or you push it too fast, you're basically inviting cardiac arrest to the party. Never, and I mean never, Never in all capital letters, push potassium. You will use an infusion pump. You will dilute it, and you will put that infusion pump on a slow drip. like 10 MEQs per hour, slow drip. Yeah, you heard me, 10 MEQs per hour, all right? In addition, if you're using potassium, you will always, always, always have your patient hooked up to an EKG and be monitoring their serum potassium levels. Please, for the love of all that is good and holy in the universe, monitor your IV site when you are running potassium. Potassium can burn your patient. It's going to look like your patient's arm has been on fire. So please, please monitor that IV as well. All right, magnesium sulfate. This is another one that can go sideways fast. It's used for hypomagnesemia and for preeclampsia or preterm labor in pregnancy. But too much, you get the muscle weakness, the respiratory depression, and the possibility of cardiac arrest. It's like flipping the off switch on the whole body. So you've got to keep, ready for this, calcium gluconate nearby. This is your antidote for magnesium sulfate. Watch those deep tendon reflexes. If they disappear, you're in big trouble. So yeah, vitamins and minerals aren't as innocent as they look. Know your labs, double check your protocols, and don't be afraid to ask for help. Trust me, it's better than explaining to your charge nurse why your patient's IV site looks like a volcano. That's it for today. Next time we'll tackle even more medication shenanigans. See you next time.